So hello everyone, in this video I'm going to demonstrate you about our new AI assistant prescription writing tool which is PresWritePro. So let's go to the application. Okay, so this is the login page for the PresWritePro, and before jumping into the brief demonstration, I just want to tell you what this app really does. So let me tell you, this is an AI enabled prescription writing application that is designed to make doctors work much easier and faster. Like in the current medical system, doctors often spend a lot of time manually writing prescriptions, entering patient details, and double checking for errors. So this takes away valuable time that could be spent on patient care. So our app solves this problem. It automatically fills in the patient detail, format prescription neatly, and even generate complete prescription using AI just from the doctor's voice or few words of input. This means doctors save time, reduce human errors, and patient receive faster and safer treatment. So now let me show you how it works in real time. Okay, so suppose you are a doctor and you came to this app. So if you don't have any account, you should go to the don't have an account and register here. Let me also register a sample. Okay, so here I should name the doctor Varun Joshi, and the number is 8527427481. Okay, an email address I will generate it's sample email address. Specialty, let's take the dermatologist. Medical reference number 8527. City Delhi. Password 12367. Okay. Okay, so it says registration successful. You can now log in. Okay, let's go to the login page. Okay, let's write. Okay, as you can see, we are here. Welcome, Varun Joshi. This is the doctor's dashboard. So as you can see here, you can change passwords, uh, and you can go back to the dashboard. You can also log out from here. Here you can see patient today's, patient this month, and total prescription. So this is for the doctor dashboard, like whatever the patient he have taken, and how much patient have come in this month, what are the total prescriptions. And this is the activity reports, like today how many patients have come, this week, this month. So currently it is 0 because we have created a new profile. So we can also set the range from where, like last 30 days. We can also put a custom date, like from 1 July to 1 August, how many patients have come. So it will show the complete details. And we can also find patient history, like whatever the patient they have cured. So they can see, like in the past they have diagnosed such patient or something like that. Currently it's no prescription found for the patient because it's in sample doctor ID. Okay, and here come the prescription medicine app. So let me just quickly log out this and log in a doctor ID where there is actual data is there. Okay, so this I am just logging it. So as you can see, 4 patients today, 8 patients this month, and 23 total prescriptions are there. Okay, and just for your note, all the data has been used in this application. The doctor name and the patient name is not real. These are the dummy data. So as you can see now, patient volume has also come. Like 2 patients have come in July, 3 patients come in July 31, and we can also check this week. 4 patients have come this month, last 7 days, last 30 days, and last 365 days. So it saves complete track of the patients also. Okay, and here you can see all the patient name and recent patients and mobile numbers are present there. Adrit Roy, Anirudh Joshi, Anirudh Joshi. And if I want to find any patient with the mobile number, so as you can see, we have find Anirudh Joshi. which which is previously registered in this doctor. So now we can also see whatever the last prescription this Anirudh Joshi have. So Dr. Subha Bahapal, which is a test doctor, has taken this prescription. The patient, a 22-year-old male, present with three concurrent issues: acute onset lower back pain. This is the diagnosis. So this is the prescription we got, and we can also download it in PDF. Okay, so this is the PDF we get. So it's really helpful for the follow-ups, like the patient follow-ups, or even check what disease they previously have, or the patient is already registered in their account or not, or the patient have come is a new patient. So all that we can see here. And after that we have a practice insight, which tells you about which medicine is most prescribed. Like as you can see, metamorphin is most prescribed by the doctors. Number of prescription is 14. Crocin is the second one. Number of prescription is 9. So we can see like which medicine is prescribed more from the doctors. We can also check the patient gender distribution, like females, how many females have come, how many males have come. We can also check the age groups, like mostly the age groups have come, which is 36 to from 36 to 55. So we can take all this data for the analysis, or for some research purpose. So all this data is also present here. We can check the recent prescription, that is for the Anirudh Joshi, as you can see. And swastika pile, you can see acute gastroenteritis infection, considering fever and long infection context. Okay, so let's go to the app. So how you can do all these things, how you can create the prescription. So you should go to create new prescription. So here doctors have come, and already doctor name have come automatically, like, and its registration number and specialty. What doctor will do, it will ask the mobile number of the patient. So suppose the mobile number is 96544711086. Now it will search. Okay, so as you can see, just by searching we got the existing patient found. So this patient is already have come to the doctor before, so that's why it's registered on the server, on the basically on the database. So it directly come from there, like all information, Anirudh Joshi, age 42, gender male, and all like that. We get all the information from there. Okay, now this is the void dictation app. Suppose the patient has tell the problem, like he have a fever, or sore throat, or a runny nose, and all like that. So the doctor will speak here whatever the problem the patient is having. So let me give you an example. The patient presents with acute lower back pain after lifting a heavy object yesterday, and the pain is sharp, localized to the lumbar region, and radiates slightly down the left leg. There is no numbness or weakness on examination. There is tenderness over the L4 L5 vertebrae. So this thing I have, right? And if the doctor wants to basically correct it with the medical terms, or rephrase it, so he can do this, correct medical terms. So it's processing now. Okay, so as you can see, this is the original text, and this is the corrected text, the refined text. Basically, a 22-year-old male report acute lower back pain which began yesterday after lifting a heavy object. The pain is described as sharp, localized to the lumbar region, and all like that. Professional diagnosis: low back pain with radicular symptoms. It also recommend you the medications, like as you can see, like non steroidal anti-inflammatory drugs, and all these medicines. And now let me show you. Now we have an option to use the original one if you want, or you want the corrected one. Let's choose the corrected text. Okay, Now we will format it with AI. As you can see, these information are empty right now. Now we'll be formatting it with AI. Okay, now you can see it automatically fills. Chief complaint: a 22-year-old male report acute lower back pain, which began yesterday after lifting a heavy object. The pain is described as sharp, localized to the lumbar region, and radiates slightly down the left leg. Clinical finding: on examination, there is no tenderness palpated over the L4, L5 vertebrae level. Okay, and it also generates the medication by itself, as you can see. Ibuprofen, a tablet. We can also select the dosage as per require, or when to take: before food, after food, how many time, how many days it should be taken. And it also give other instruction like take one tablet orally with food or milk to reduce stomach upset. This is the second medication we get. And if suppose a doctor doesn't want this, so he can directly cross it and add a new medicine, and it can like write whatever the medicine name, and in which form it should be taken, how many dosage, when to take, and doctor can manually do it also. Okay, let's remove it. Okay, so if there was some test, so it was also got written here, but in this situation there was no test, so that's why it's not there. Anything was not there. And advice was also there from AI. AI also gave a advice like avoid heavy lifting and activity that aggravate pain or for a few days. However, staying active within pain limit is crucial. Avoid prolonged bed rest. We can set the follow-up date for this, like we will select 12 August. Okay. Now what we can do, we can directly download the PDF. Okay, let's see the PDF. So as you can see, it converted it into a whole prescription. Like doctor name Subha Bahapal, test doctor, patient is also come. The complaint is also there, like lower back pain. Diagnosis was also there. Clinical findings, medication, and also the advice was also there from the AI. That is really helpful for the person, for the patient actually. Okay, now we'll go back to the app. Now what you can do, you can directly send this prescription to the person. Let me show you how. Suppose I have write the patient number and share with WhatsApp. As you can see, it directly open the person WhatsApp number, and you what does you need to do is just send it. As you can see, you have sent it right now. So it's really helpful for the patient as well as for the doctor to save time, and it is much more faster and efficient. And I think it saves a lot of time for the doctor, like the valuable time they have. And it also create the patient database also, like so it will be helpful for the doctor for the follow-ups also, because the patient is already present in the database, so he can see like what prescription they previously have, and what disease they already have, and all like that things. So thank you, this is the application. Thanks for watching.